Allow me to share with you how documentation of your client's soft tissue spinal injuries based on the three phases of healing will double your injury claims in 30 days. Our medical team has developed a four-step system to document soft tissue spinal injuries, supporting patients and their attorneys in doubling their injury claims. Let's start with the understanding that Colossus or Colossus type software is used by the auto industry to determine compensation in over 70% of bodily injury cases. Our medical team understands the primary source of financial value drivers for soft tissue spinal injuries are from the doctor's notes, reports, and narratives. Therefore, the physician is the most important part of Colossus and the injury claim. Be aware there is a soft tissue spinal injury often not documented by physicians that frequently leads to patients' chronic pain and disability while limiting the injury demand of their attorney. This soft tissue spinal injury is called alteration of motion segment integrity, or AOMSI. According to the AMA guides, alteration of motion segment integrity yields up to a 25% impairment rating. When our team of doctors document alteration of motion segment integrity, it will support all five major financial drivers, giving the patient and their attorney the documentation needed to demand a larger injury claim. This is how our medical team documents all five major financial driver categories to double your injury claim in 30 days. Let me share with you the four major points to qualify your clients for the soft tissue spinal injury alteration of motion segment integrity. First, it requires an understanding of the three phases of healing and that no injury ever heals at 100% normal. Second, it requires the doctor's ability to objectively document the soft tissue spinal injury for higher financial demands should the case go to trial. Third, the doctor should have the knowledge and ability to measure the injury using the industry standard AMA Guides to Impairment for maximum financial compensation. Fourth, the doctor should have the knowledge to document, measure, and report the soft tissue spinal injury based on auto injury software such as Colossus to support your injury claim. The soft tissue spinal injury claim starts with a basic understanding of the three phases of healing. The three phases of healing are the inflammation phase, the repair phase, and the remodel phase. There are five reasons why an understanding of the three phases of healing is important for higher demands for soft tissue spinal injury claims. First, no injury ever heals 100% normal. Second, a knowledgeable doctor can objectively document alteration of motion segment integrity. Third, alteration of motion segment integrity can be measured. Fourth, alteration of motion segment integrity frequently results in positive duties under duress or loss of enjoyment of lifetime activity findings. Last, the doctor must document and report alteration of motion segment integrity in consideration of the auto industry software such as Colossus. When our medical team documents these 5 points, you can ask for and expect to double your soft tissue spinal injury claims in 30 days. Understanding soft tissue spinal injuries starts with the knowledge of the three phases of healing, which is a physiological fact. The most important aspect of the three phases of healing is an awareness of the four negative effects of repair collagen or scar tissue. Collagen is the scar tissue that repairs the body. It is produced during the repair phase of healing. There are two negative effects of collagen on connective tissue and two negative effects on peripheral nerves that will support your injury claim when documented. The two negative factors that affect the soft tissue are, number one, repaired collagen is only 70% as strong as the original tissue. Number two, the repaired collagen is only 70% as mobile as the original tissue. The two negative factors that affect the nerves after an injury are, number one, there's an increase in the number of peripheral nerve endings, And number two, these nerve endings fire at a lower threshold. Let me share with you how documentation based on the three phases of healing will support your soft tissue spinal injury claim. First, 70% of soft tissue strength leads to altered spinal mobility, affecting alteration of motion segment integrity. Second, 70% of tissue mobility creates spinal restrictions and therefore also affecting alteration of motion segment integrity. Third, there's an abundance of nerve endings in the spinal joint capsules, creating pain and resulting in positive duties under duress findings. Fourth, there's an increase in nerve sensitivity, which means the patient will experience more pain, causing positive loss of enjoyment of lifetime activity findings. Duties under duress and loss of enjoyment of lifetime activities are measurable conditions according to the AMA guides and Colossus. The alteration of spinal mobility can be measured and yield up to a 25% impairment rating, which also significantly enhance your soft tissue spinal injury claim. This is how our medical team documentation of your client's soft tissue spinal injury will double your injury claims in 30 days. We document alteration of motion segment integrity to include the impairment rating, duties under duress, loss of enjoyment of lifetime activities, and a lifetime injury prognosis based on the three phases of healing. Now let me share with you why alteration of motion segment integrity is often overlooked and not documented by treating physicians. Each spinal joint has three ranges of motion. The active range of motion is the gross range of motion patients can perform on their own. The passive range of motion is the motion which occurs past active and can only be reproduced externally. Last, the paraphysiological joint space motion, or joint motion, can only be reproduced by a physical medicine doctor such as a chiropractor. If you recall, I spoke earlier of how during the repair phase of healing, collagen or scar tissue formation often leads to alteration of motion segment integrity, affecting the joint space motion. After treatment, it is common to have normal gross spinal range of motion, but abnormal joint space motion. Let me emphasize what I just said. After treatment, it is common to have normal gross spinal range of motion, but abnormal joint space motion. This is why alteration of motion segment integrity is often not documented by treating physicians. When alteration of motion segment integrity is not documented by the treating doctor, this will significantly limit your soft tissue spinal injury claim in all 5 financial driver categories. It is important to understand how to document and measure alteration of motion segment integrity. To document alteration of motion segment integrity, we use a process called computerized radiographic mensuration analysis, or CRMA. By using computerized radiographic mensuration analysis, we can objectively measure abnormal spinal joint motion, including the spinal joint capsules, intervertebral discs, and ligaments. This abnormal joint motion results from the scar tissue or collagen, which is only 70% as strong and only 70% as mobile. So be aware there are 5 factors to consider for documentation of your soft tissue spinal injury claims. First, how an auto injury is affected by the 3 phases of healing. Second, the 4 negative effects of repair collagen or scar tissue. Third, the 3 ranges of spinal motion. And fourth, the soft tissue spinal injury, alteration of motion segment integrity. Fifth, documentation by computerized radiographic mensuration analysis. Once again, these are the steps our medical team documents to support your client's soft tissue spinal injury and double your injury claims in 30 days. We document alteration of motion segment integrity to include the impairment rating, duties under duress, loss of enjoyment of lifetime activities, and a lifetime injury prognosis based on the 3 phases of healing. Now let me share with you how the AMA Guides rates alteration of motion segment integrity. The 6th edition of the AMA Guides to Impairment Rating on page 577 describes alteration of motion segment integrity. The process of how to objectively measure alteration of motion segment integrity is key to maximizing the financial compensation for your soft tissue spinal injury claims. We started with the principle that auto injury compensation is based on colossus, and the most important factor is the doctor's notes. Our medical team and personal injury case management takes into consideration the 5 most important value drivers for soft tissue spinal injury claims as seen by colossus, and they are: number 1, the injury diagnosis, specifically alteration of motion segment integrity. Number 2, the impairment ratings based on the AMA Guides to Permanent Impairment. Number 3, loss of enjoyment of lifetime activities. Number 4, duties under duress. Number 5, a permanent and limiting prognosis. The following 7 principles are important to support and maximize your soft tissue spinal injury claim. Number 1, based on the 3 phases of healing, auto injuries never heal 100% normal. Number 2, auto injuries commonly result in alteration of motion segment integrity, which affects the spinal joint motion. Number 3, alteration of motion segment integrity can be demonstrated and supported by computerized radiographic mensuration analysis by our medical team. Number 4, alteration of motion segment integrity is a rateable condition based on the AMA Guides carrying up to 25% impairment rating. Number 5, our medical team documents how alteration of motion segment integrity limits loss of enjoyment of lifetime activities. Number 6, our medical team documents how alteration of motion segment integrity restricts duties under duress. Number 7, alteration of motion segment integrity is a pathological process which starts osteoarthritis, the leading cause of disability in the United States. Our medical team includes pain management, orthopedists, neurologists, and chiropractors. We understand and document soft tissue spinal injuries to include all 5 major financial injury driver categories. This is how our medical team documents your client's soft tissue spinal injury to double your injury claims in 30 days. We document the soft tissue spinal injury, alteration of motion segment integrity, including the impairment rating, duties under duress, loss of enjoyment of lifetime activities, and a lifetime injury prognosis based on the 3 phases of healing. Call our office for a case example on how our medical team documentation of the soft tissue spinal injury, alteration of motion segment integrity, based on the 3 phases of healing will double your soft tissue spinal injury claims in 30 days.